Hi, my name is JC Blandingham, and I'm going to be doing my sterile glove technique and my sterile dressing change skills video. Throughout my entire skill, I'm going to maintain my GPSP, and I'm going to go ahead and verify the order before I go in the room. I'm going to perform my hand hygiene as I go in the room, and I'm going to identify the patient with name and date of birth. I'm going to check their band to make sure it matches. I'm assessing the patient for any allergies, and I'm asking about pain. If the patient was in pain, we could check for an order for any pain medication, but my patient's not in any pain. So I'm going to go ahead and get everything set up. Okay, this is my trash, and I'm going to go ahead and do my hand hygiene. And I'm gonna put on my clean gloves. Now I'm gonna remove the old dressing using the push-pull method. You could use saline if it was sticking to loosen it up. And we use the push-pull method so we can pull from the center or remove from the center. Now we're checking the drainage on our old dressing for, we're doing taco, we're doing type, amount, color, and odor. And we're gonna dispose of this. And we're removing our gloves. And now I'm doing my hand hygiene again. And I'm just assessing the wound for the overall appearance. I'm looking at size, any drainage or discharge, and we're checking pain again. So now I'm gonna go ahead and I'm gonna get ready to set up my sterile portion. And this is my unopened dressing change tray. And I'm gonna pull it towards me. And making sure not to go over it. We're gonna move this out of our way. And now I'm going to grab my gloves. I'm performing hand hygiene. Before we would do our gloves, we wanna check the expiration date. We wanna make sure it's not been opened, and we wanna make sure it's dry. So I've already performed my hand hygiene. Now we can begin. And then using my 1-inch border, if I can get a hold of it, we're gonna pull this out. I'm just walking my fingers up to open it completely, staying on my 1-inch border. And if this would come back over the glove, we would have to get a new set of gloves. But now I'm gonna go ahead and using just my staying above my waist. Sorry for the background noise. Now I'm coming over to get my other glove, making sure to keep my thumb out, and I'm holding the 1-inch border. My fingers are messed up, but we'll fix that once we get them on. Thumb's still out. And now I can fix these. And then I'm just grabbing the top of my glove right here and just pulling it back a little bit. Okay, now to remove my paper, I'm going to grab in the middle, and you want to make sure not to let the paper touch you. And I'm just going to, this is my trash, making sure it doesn't touch me. And now I'm going to clean the wound. We're going straight down the middle first. And then I'm making sure not to go over the wound. Now we're cleaning this side. And then again, not going over the wound, we're going this side. And now to dry, we're going straight down the middle. We're going on this side. Now I'm going this side. And then now I'm going to throw these away. I'm going to remove these. I'm going to perform my hand hygiene. And now I'm going to apply them like this. Making sure not to go over. I'm going to flip this back. And now I'm going to use my 1-inch border. And I'm walking my fingers up the border. Holding my 1-inch border, hitchhiker thumb. done. Now I can fix my fingers. And I'm just gonna pull it from the top, move it back a little bit. And I want to fix this one. And now I'm just going to pinch the middle. Here. And I'm going to dispose of this in my trash. Keep my hands above my waist. And I'm going to get my new clean dressing straight up. I'm going to perform my hand hygiene. Well, I'm going to tape on all 4 sides, and I'm also going to date, time, and my initials. And that's my skill. Thank you.